22-year-old kid, football star. Can you imagine?
It's been 12 hours. He's still unconscious.
Diffuse cerebral edema. We've tried cooling catheter, magnesium, mannitol, nothing's worked.
I read about his previous concussions. He must have taken one hell of a hit.
It was an accident.
What about a craniotomy?
Yeah, right.
The Army's been doing craniotomies for brain swelling.
I know you had a relationship with him, but I'm not comfortable taking off half his skull without a clear-cut indication.
The medical therapy isn't working.
Nurse, with the prolonged elevation in ICP, his brain is toast.
Carlson, she's looking for solutions here. A craniotomy would definitely lower the pressure in his brain, which directly correlates with increased survival. If you want to pass, that's fine. I got a friend at Robert Wood Johnson who'd be more than happy to do it.
Okay, fine. But I gotta tell you, I'm not optimistic.
Thank you.
Chloe. We're gonna do everything we can. Sir, I gotta take this. Norm, talk to me.
Hey, Chloe, how you doing? How's Andy? He's still in surgery. I never should have interfered.
Hey, you were trying to do the right thing.
But if I hadn't told his coach, then he wouldn't have gone to Delaney's, and he wouldn't have gotten so angry, and he wouldn't have hit his head.
Chloe, craniotomy went well. He opened his eyes. We're nowhere near out of the woods, but it's a lot better than expected. Mm-hmm. Good call.
That's great. Thanks, Joe.
You okay?
Huh?
Have you eaten something today?
I don't know. No.
Well, then, make sure she eats something.
What is it? What's happening?
Andy was doing well after the surgery. Then his ICP went through the roof and he blew a pupil.
Did you take him back to the OR?
He failed his apnea test. No electrical activity in the EEG. No cerebral blood flow. He's brain dead. I'm sorry, Chloe.
Mr. and Mrs. Westcott? I'm Chloe Payne. I was a friend of Andy's.
Chloe, of course. Andy told us so much about you.
I'm so sorry.
You meant a lot to him.
He was such a nice boy, Mrs. Westcott.
Andy had said he wanted to be an organ donor, and they won't let us be there when that happens. I know he's gone. In my head, I know that. But the thought of him being all by himself,
I can be with him. I can do that. I'm still his nurse.
Thank you.